washing my hands. Hello, my name is Lauren Marco. I'm a nurse practitioner. I'm going to be doing a cardiac examination today. Can I have you sit up a little bit over there so I can get you about 30-degree angle? Okay, turn your face. I'm looking for jugular vein distension or abnormal carotid pulsation, which I did not see on this side. The same on this one. Again, looking for abnormal carotid pulsation and jugular vein distension, which I did not see. Next, what I'm going to do is I'm going to measure the jugular vein pressure. I'm going to get a ruler, straight line. I'm going to get at the sternal angle, and then the maximum over here. So it's about 2 centimeters. I'm going to add 5 to it, so his jugular vein pressure is 7. Next, I'm going to palpate the carotid pulse. It's brisk and smooth, +2. Next, we're going to move on to palpating the point of maximal impact. I did not have the attention to lighting, so that is why I wasn't able to visualize it. I did not inspect any abnormal pulsation. I'm just going to start palpating. So we're going to go 3, 4, 5th. I'm going to come mid-clavicular line. It's a brisk single tapping. It's about a quarter size. Next, we're going to move to the 5th, 4th, and 3rd. Looking at the systolic impulse of the right ventricle. Then we're going to move to the 2nd. The pulmonic artery impulse. And then we'll move on to the aortic arch impulse. And I'm also going to feel for heaves. I was not able to feel any heaves or lifts, and no thrills palpate on the carotid artery. Next, we're going to move on to auscultating. I'm going to hit the diaphragm. I'm going to start. Actually, no, before I do that, I'm going to go on percussing the left arterial wall. So we're going to start. Feel resonant. It's dullness. So dullness indicates the left arterial wall. Next, we're going to move on to auscultating. I'm going to start a second coastal space. Listen to the aortic valve. And then we're going to move on to the pulmonic. Second coastal space. Third, Erb's point. Tricuspid. And then mitral. I was able to hear S1, S2, no S3 or S4 is heard. Next, we're gonna listen to the bell. I'm gonna move across the left sternal. I wasn't able to hear any extra sounds, no S3 or S4. The bell tends to hear lower pitched sounds. Next, I'm going to have you move to the left. Just like that. I'm listening to the apex. Then I'm going to move across the left sternal. I heard S1 and S2s, no S3 or S4, no murmurs heard. Next, I'm going to have you sit up a little bit. So when I have you on the left side, that kind of brings the apex closer to the chest wall, which allows me to listen to for mitral stenosis or mitral murmurs. Now the diaphragm. I'm also going to listen for bruits, for thrills on the carotid. I wasn't able to auscultate any murmurs. No S4 heard. If I did hear murmurs, I would note their location, the intensity, the location of maximum intensity, shape, duration, radiation. And this concludes this examination.